Well, hello, and thank you very much for giving us your time to contribute to this series of interviews that we're calling 10 Minutes with ILPN. If I could start by asking you just to introduce yourself a little bit, your name, where you're working, etc.
Sure. So my name is Julien. I work at the PSSRU at the University of Kent and the London School of Economics, and I'm a Deputy Director of a research unit that focuses on research on long-term care, healthcare and other public services.
Thanks. And in terms of what you do day to day, how would you explain to a lay person type of research?
Okay, so we mainly do research for the government. So we look at policy issues relating to long-term care, we do evaluations and analysis, and we try and improve the way services are provided and funded.
Thank you very much. And in different countries there are different understandings about what is meant by long-term care. So
Sure.
If you had to define it very briefly, what do you mean by long-term care?
Well, you're right, there are different views as to what constitutes long-term care, and I'm sure there are some grey areas, but essentially the way I see it is it's about services that provide support for people who have long-term conditions, who have to manage those conditions on a day-to-day basis. Most often people think about residential care or nursing care services where people go and live in a care home, but there might be services that maintain people at home or even to try and rehabilitate people with those long-term conditions.
Thank you very much. And so now in terms of what you think is the most important policy priorities in England where you live, so if you had to define three, which ones would you pick up as policy priorities?
Well, I think funding is also a big issue. It's an important problem. Many people would argue that the system is underfunded at the moment, others would disagree, but I think most people would also say that the way the system is funded, the rules by which people are charged for their services are pretty difficult, complicated and have a number of limitations. So reforming the way that the system is paid for would be a key priority for me.
And when you say system, are you referring to the public system here?
Mostly the public system. As a little bit of context, it's worth saying that in England around 60% of services, long-term care services for older people, people over 65, are paid for partly or fully through the public purse by the state, and around 40% of people pay for their care privately out of pocket, paying as they go from their own savings and income.
Thank you very much. So funding is one important priority. If you had to pick up another or a couple of other, which ones would you?
Sure. Well, I think the issue of quality of care is also pretty high on the list of priorities. There is research out there which suggests that some quality issues are significant, i.e. low quality of care being provided, and the mechanisms by which quality can be improved seem pretty weak at the moment in the care system. So much more, I think, could be done in order to promote better quality of care, to focus the care system on what is really important to people and not necessarily what's important to the care system, i.e. the way that things run in the organisations, but what's really important for people. So that's a focus on quality of life, on well-being, as well as maintaining people's physical and mental health. So that is an important issue, and there are a number of ways that you can approach and tackle that particular problem. Many of them have a price tag associated with them, but there are also different ways in which services can be commissioned, services can be regulated to ensure that people are getting the best quality possible.
Thank you very much. And so in terms of the English long-term care system, how do you see it evolving over the next 5 to 10 years?
Well, we have this significant debate at the moment around funding. In fact, that's been going on for quite a few years, certainly for the last decade, but at the moment the government is considering a report by Andrew Dilnot, which looks at a system reforming the funding of care, with an emphasis on capping the liability that people have for the costs of care. And so that's an issue, that's a policy option that's on the table at the moment and is being debated by politicians. So I think that will certainly remain on the policy radar for a while. Quality is also very important as well. So there are a number of measures in place, but people are considering new ways to improve the quality of care. And certainly there's a high focus on that. I would also say actually that the legal framework is pretty important. We've just undergone a big exercise to reform the legal framework in which care is provided in this country. The legal basis of it was pretty fragmented before, and it's now being drawn together. So that's just appeared on the statute books and will require some work to implement that on a practical basis. So that's an important issue. And then I would say the last thing is regulation. So it's important obviously to maintain the standards of care, to make sure that they're safe and that people are not put in danger by care services, and that organisations are properly licensed and regulated. And so at the moment the CQC, the Care Quality Commission, are responsible for doing that in England. But they are themselves considering how they develop their strategies and approaches for the future.
Thank you. So do you get the feeling that the current financial crisis is affecting significantly the long-term care system in England?
I would say it is to some degree, yes. Councils have had to operate under tighter financial constraints than they probably would have done had the economy been in better shape. And the ramifications are that they've had to tighten some of the access criteria so that fewer people are being provided services than perhaps otherwise be the case if the economy was in better shape and public funding was at a higher level.
Thank you very much. And so now think of yourself as a benevolent dictator, well, benevolent or otherwise. But if you could choose one policy that you had the power to introduce, what would that be?
Only one?
Yes, just the one.
You're being harsh. Well, I mean, certainly if you're going to balance off the sort of possibility that this could get implemented, then I would say reforming funding would be a high priority for me. I think that there are certainly changes that can be made relatively easily that would improve the way that resources flow around the system and help those people, particularly self-funders who are in that sort of squeezed middle bracket, help their lives quite a bit. And those things could be achieved relatively easily. So yeah, it may not be the most ambitious thing to try and aspire to, but I think it is doable, and therefore I hope that we see some policy change on that issue pretty soon.
Thank you. And from the research point of view then, what do you think is the outstanding piece of research that hasn't been done, or that that evidence that we yet don't know, which would contribute to improving the system in England?
I still think we lack a lot of evidence about the impact of services. So the impact in terms of how those services promote quality of life and well-being for service users. So we still have a long way to go in understanding what they are. I mean, we have a pretty good idea that services have positive beneficial impacts on people, but to be able to quantify those impacts means that we could then come up with a better way of allocating pretty scarce public resources to those services that best promote the outcomes that we want to achieve in the care system. So to do some more work along those lines is important. So measuring outcomes is a pretty crucial part of that process, not the only part. And there are a number of new tools that are being developed and promoted. So the ASCOT tool, for example, the Adult Social Care Outcomes Toolkit, is one such measure that is now being considered and seems to have some promise. So that would be an important aspect. And then I think better data about how services work, more research of a comparative nature that does a more systematic job of evaluating services, evaluating within a proper framework, having proper trials of services to ensure that we can be clear that the impacts that we measure are actually due to the services themselves and not other factors.
Thank you very much. So now the last four quick round questions.
Okay.
If you have to, rate these on a scale from 1 to 10, 1 being the worst and 10 being the best.
Right.
How would you rate the policy priority that is allocated to long-term care in England?
The policy priority?
Yeah. How much of a policy priority is long-term care in England?
Well, and you just want me to give you a number. I would say it's probably a 6 now. Although that's higher, certainly higher than it has been in the past. In the past, it's been pretty low down the political priority. Now it is there. Actually, maybe you can go to a 7 in the future, but at the moment, I'd say around a 6.
6 to 7, very good. And how aware do you think the general public are about the long-term care system? What is on offer for them, for people who are in need of care?
How
aware?
How aware they are?
How good is their
General
understanding?
public?
Yes.
I think that's part of the problem, actually, that the awareness by the general public of long-term care services is pretty low. Certainly in this country, there's a much higher understanding of how the National Health Service works, but far less of an understanding of how the long-term care system, the social care system works, and that in fact that's a distinct system from the NHS. And that actually is one of the issues that politicians face, is that people don't understand the care system very well, and they don't understand the limitations of the care system very well.
So your rating?
Rating at 5.
5?
Maybe.
And again, on a scale from 1 to 10, how well do you think the current system, the public system, supports people with long-term care needs in England?
Actually, it's like other services. I think once people are in the system, it does a reasonable job. I think that's pretty much the case. I would say probably a 7 for people in the care system. There are people that suffer very badly, and there are people that do very well, as in any other system. Boiling it down to a single number is difficult. So I'd say a 7, but certainly room for improvement.
What about carers?
Not so good for carers, I would say. There are some provisions, there are some benefits that people can have. Local councils as providers of social care have some responsibilities to carers, but actually the priority is much more on the service user at the moment. So I think more could be done there. I'd say probably a 5, maybe a 6.
Great. Well, thank you very much.
Very welcome.